Welcome back to the Kiosk Presents. I know it's January, you're probably not thinking about the flu, but the Center for Disease Control and Prevention forecasts that the flu is going to go into March. Here to talk about the flu and what you can do to avoid it is Dr. Leonard Friedland. He's an infectious disease vaccination specialist. Dr. Friedland, welcome to the Kiosk Presents.
Thank you, Laurie. And you started off by saying you might not think about influenza in January, but absolutely this year you need to. Influenza started late this year. It's widespread throughout the nation right now, and as you say, it's going to go all the way through February, perhaps even into March.
So this has been, the flu season started a little bit late. Has it been a particularly bad season this year for the flu?
Yeah, well, what we're starting to see is it's becoming a pretty serious influenza season where communities are seeing a lot of influenza. Emergency departments are being overwhelmed with number of cases. People are missing school, missing work. And unfortunately, we're starting to have reports of the deaths that we unfortunately get every year from influenza. Influenza is unpredictable, but it's predictable because it happens every year. And what we're seeing this year, Laurie, is that the strain that's causing the majority of illness is the H1N1 strain, the strain that caused the epidemic back in 2009. The good thing is that all the vaccines for influenza this year protect against that strain. The bad thing is that too few people are being vaccinated. There's still time to get vaccinated. Vaccination is our best tool for protection, and it's not too late. People need to get their vaccine so they can protect themselves and those around them.
Now, can anyone get a flu shot, or are there certain people that may want to avoid it?
The Centers for Disease Control recommends that every year, virtually everybody above the age of 6 months receive an annual flu vaccine. There may be some people who have a contraindication, but those are extremely rare circumstances. And so people should speak to their healthcare provider, speak to their pharmacist. There's a vaccine for virtually everybody, including those who have, for example, very severe egg allergies. And the important thing about influenza is that vaccine manufacturers and research groups like the team that I work with at GlaxoSmithKline, we're constantly working with the public health community and with the Food and Drug Administration to make certain that vaccines are innovative, are providing even more opportunity for protection, and are available. And that's exactly what we have this year. We have a great quantity, good supply of vaccine. We have innovative vaccines, including what we call the new 4-strain vaccines that protect against the 4 strains that commonly circulate. Vaccines are available. All the groups are looking to be leaders to make sure that our public is protected. That's what our research team is doing. But what's needed is that people use the vaccines. And vaccines are available. It's not too late to be vaccinated. It's really, really important.
So in addition to the flu shot, what else can people do to either avoid the flu or take care of it once they have it?
Well, the best tool for protection is vaccination because, unfortunately, if you get the flu, it can be very serious. It's a miserable illness that lays people up in bed. They miss school, they miss work. People are hospitalized, and unfortunately, in the United States, some years up to 40,000 people can die from influenza. Already this year, we're hearing of the deaths, including pediatric deaths, all across the United States. You can't really avoid being exposed. It's all around the United States. So things like covering your nose when you sneeze and hand washing, those are good public health infection control tools in general, but they're not going to protect against influenza. The best protection is vaccination. That's what's needed.
So say you get the flu, is there anything you can do to lessen it, or do you just have to ride it out?
Well, the first thing is to recognize actually what is influenza. A lot of people think they have influenza when they have just a mild or a standard sort of winter cold. Influenza can be very serious with high fevers, shaking chills, and just being laid up in bed, unable to work, go to school. And if that's the case, you want to know that you have that because you don't want to be spreading it. Once you get influenza, if you're not recovering within 1 or 2 days, you should absolutely speak to a healthcare provider because there are other things that can be done, some medications that can be used. Or if you have an underlying medical problem, somebody with asthma, somebody with a neurological illness, somebody with diabetes, people who are pregnant, people who are very overweight, they should speak to their doctors immediately because they are at higher risk for getting severe complications. But it all goes back to where we started. The best tool is vaccination, and it's not too late. We know that only about 30% of the young and middle-aged adults are vaccinated right now in the United States. That's the group that's predominantly getting influenza this year. And it's important that that group of individuals, but everybody as well, get vaccinated if they haven't already. It's not too late. Vaccine is widely available in the large retail pharmacies like the Walgreens across the U.S., in doctors' offices. Vaccination takes about 2 weeks to really start to have its full effect. So today's the time to get vaccinated, not next week.
So with the vaccination, there's a lot of myths and stories out there. What is the fact versus the fiction on the flu vaccine?
Yeah, so probably the biggest myth is that, oh, I don't want to get the flu vaccine because it's going to cause me to get influenza, or the last time I had the flu vaccine, I got the flu and it was from the vaccine. Not possible. Influenza vaccines cannot cause influenza. So that's a myth. The fact is that influenza vaccines are safe and effective. They can cause some redness and swelling at the site of the injection, which means that the vaccine is starting to work. So people may confuse that with flu, but that is not flu. What the flu vaccines do is protect against illness for people getting vaccinated and those around them. And that's really important, especially now that we're in the midst of a nationwide epidemic, and it's really critical that we protect our public.
Well, Dr. Leonard Friedland, thank you so much for joining us here on the Kiosk Presents in Buffalo and Western New York. Lots of good advice about avoiding the flu this year.
Thanks, Laurie, and stay healthy.